Okay, we're on. What's going on? We are back here for another live episode of Pharmacy Unplugged. We are ready to take your practice to the next level. Today, we have a good topic. We are diving into MedsCheck, the government-funded service that was supposed to help patients understand their medications, catch any problems, and also make us look good, right? But what if the service that's meant to be keeping patients safe has turned into a numbers game? Is MedsCheck still a useful tool, or has it just turned into like a checkbox exercise to help corporate pharmacies chase the bottom line? So today we're talking about the good, the bad, and some of the controversial issues surrounding MedsCheck. So make sure you stay tuned until the end. As we always do, before we begin, we want to thank you guys for tuning into our show, wherever you're listening in from. Thanks for listening, especially if you're joining us live right now. Get those fake accounts ready and interact with us. And make sure you support us by following us on Spotify. We have all our previous episodes there. Join us live on YouTube. As you guys know, we like to interact with you guys. We're usually here every other Friday night, Eastern time, 9 p.m., sometimes more. And connect with us on social media. We're also on X. Handle is @PharmUnplugged. And we're also on Reddit as well. We also have a website and an email. You guys can reach us.
Website pharmacyunplugged.com.
Mm-hmm.
All our links to our socials are on there.
Mm-hmm.
And you can send us an email as well with all your thoughts. Pharmacyunplugged@gmail.com.
That's right. How was your week?
It's pretty good. I'm slowly getting my voice back.
Oh, it was still like from before?
A little bit. It's usually worse at night.
It took so long for you to recover.
I don't know what it is. At nighttime, like in the morning, I'm good.
Mm-hmm.
But at nighttime, it's always like a little bit short of breath.
Mm-hmm.
We learned about, like in school, we learned about that too, like with asthma, nocturnal symptoms.
Do you have asthma? You don't have asthma.
No, I don't. I'm just thinking people who do have asthma, we say that's a sign of uncontrolled medication regimen if you have nocturnal symptoms.
Is that what you're suggesting?
No, I'm just saying I never really thought about why. Why is it at night?
Maybe you're lying down at nighttime, right? I don't know. You mean like before you go to bed or when you're sleeping?
Like even right now, I'm not lying down.
Oh, it's worse at nighttime.
It's worse at nighttime.
Or maybe the temperature and everything, right? So
I'm not sure. Do you think it follows like a circadian rhythm?
maybe you're less active at nighttime. I'm just guessing, right?
Yeah. So
I mean, the weather hasn't been that good, right?
No, it's weird weather here in Toronto.
That's right.
There's some days where it begins kind of cool. In the afternoon, it's really nice. And it cools down again at night.
You mean the week that we had good weather?
The week that we had good weather.
Went away afterwards. So it's almost June and we're at like, 10 degrees Celsius right now?
Yeah. It's pretty cold.
Which is like 40 Fahrenheit. I'm beginning to think that summer might not actually come this year. So I'm not really sure since it's almost June and it's not summer. Yes. But don't worry, there's always next year.
Is it climate change?
Climate change? I thought global warming is supposed to make us warmer.
That's just the name, right?
Okay. So like global warming is like changing the weather.
Climate change.
Anyway, I'm still waiting for the warm weather this year. So we shall see.
How was your week?
My week was okay. I didn't work that much because Monday was a holiday.
Oh, right? Yeah, that's right. Short week.
Yes. Did you do anything for the holiday? I didn't do anything for the holiday.
No, nothing's open. I went to... the only thing that's open are the Chinese malls.
Chinese malls?
No,
the malls are open. Like
were the other malls open?
They should be. No,
I don't think so.
Right? They're tourist attraction. No.
I think if you're near a tourist area, then yes.
Maybe like downtown, like
Toronto
open,
Eaton Center.
Right? Yeah, they should be. Like the bigger malls are open too. No, I think.
I try to stay away from downtown.
I try to stay away from people. So.
How do you do that work?
I can. That's why I don't want to work as much. So I'm very antisocial. We already talked about this many times. So anyway. Not that I don't like people. I just don't like interacting with too many people.
Maybe because you interact with people all day already.
You get tired of interacting with people, right?
Yeah.
Do you get tired of interacting with people?
I think I do.
Do you find that you interact with people more now than you were when you were working for corporate pharmacy? Oh, no. Or the same?
I think as I age, I interact with people less.
That's just the aging process, right?
You mean at work or?
At work.
At work you have no choice.
Okay.
No, I don't have a problem at work.
Okay. I find that
but outside
I had
of work,
to interact with more people when I was working for corporate pharmacies.
Oh.
Right? Maybe it was busier. There are more issues they to deal with, right?
Yeah.
More people coming in. But now I don't have to interact with them as much, right?
Okay.
They come, I help them. But sometimes my assistant will just talk to them and they'll, I want to refill or like,
right.
whatever issue they already addressed it. So
yeah.
exactly. So
That could be a volume thing.
I think it's volume based as well. And I also find that my customers are not as, can I say, needy,
Okay.
right? Like they're more,
You've trained them well.
not really. Yes, I do. But at the same time, like this area is quite well educated, I think. They like to follow rules. They research stuff. They will come in. And then they're not just going to come in and ask you like all these random
Like where the
questions.
tissue
Why is this not
paper
on
is.
sale, right?
Okay.
Like stuff like that. Or like the one on flyer, where is it, right? So like things like that. But at corporate pharmacies, you see that all the time,
Yeah.
right? Exactly. So I find that my customers are more well educated, I think. So
That's good.
yeah, they're nice.
What's the topic? What's the topic again?
So we're talking about MedsCheck today. So we're changing the way we do things a little bit. We decided to start to do a little bit more news related topics in pharmacy or in healthcare.
Like recent headlines.
Yeah. So I think that would generate more interest and discussions as well. So if you guys have any news articles that you guys want us to talk about, send it to us. If it's not topic for the whole episode, we'll still mention it as well, right? So we selected some articles that might be of interest to people.
Yeah, and if you guys have any comments about the topic or the article itself, feel free to reach us as well. pharmacyunplugged@gmail.com.
That's right.
Probably the best way to reach us directly.
Yeah. Or come on air to interact with us. If you have any comments, we'll read your comments as well. So we decided to talk about MedsCheck because there are a couple of articles that we read that was talking about MedsCheck, right? Shall we talk about MedsCheck?
Yeah,
I guess.
I mean, the latest one that we saw, title is, "We asked Loblaws why shoppers, pharmacists perform so many MedsChecks if it doesn't mandate quotas." And this is on the Canadian Healthcare Network.
I feel like maybe we should post a link to the
I'll post it in the show notes.
The show notes on YouTube and Spotify.
So it seems like whoever this reporter is asked Loblaws why shoppers, pharmacists perform so many MedsChecks even though they don't mandate quotas. And here's what Loblaw's public relations told them. But what do you think? What do you think about that question already? Like, they asked Loblaws why shoppers perform so many MedsChecks if it doesn't mandate quotas. Does that imply that they're just doing it for quotas, like already?
Yeah, basically that's what they're saying, right? Like, if you don't have quota, why are you doing so many MedsCheck, right? So like compared to the other place pharmacies. Do you want to talk about like the MedsCheck in general, and then we'll talk about the numbers that they post in the article?
Sure. Yeah, we can. I mean, we can talk about what MedsChecks is, and
because some listeners might not actually know what MedsCheck is.
It's
right?
it's a program here only, right? So
Is
people
it
in other
in-
provinces,
Is in other provinces as well?
other jurisdictions, they may call it something else, medication reviews.
Medication
But we
review.
actually get paid for these, right? So
I'm not sure if they get paid in the other provinces as well, right? So, so basically, it's a government-funded program here in Ontario. It's designed to improve medication safety and patient outcomes as well. So, as mentioned, I don't really know if other provinces have it in Canada or maybe in the States. I don't know if they have it. Maybe patients will have to pay for it. I'm not really sure. So, anyway, the eligibility for MedsCheck. So there are two types of MedsCheck. There's annual MedsCheck and follow-up MedsCheck, right? Annual MedsCheck, basically anybody taking 3 or more chronic medications, I believe, would qualify for MedsCheck. And
diabetic.
diabetic, yeah. So annual MedsCheck has $60 for regular ones or $75 for diabetic, right? So if you are taking any diabetic medications, if you're diabetic, then you qualify for the diabetic MedsCheck, right? So you're eligible to do it once a year. That's the annual MedsCheck. Okay. And then if you have done it in the past year, then you're eligible for a follow-up MedsCheck, which would only pay $25.
$25, yeah.
Right. So usually those would be generally MedsCheck for people who are starting new medications, maybe changing the medication regimen, hospital discharge, maybe. I'm sure you see a lot of those as well. Right. So those would be like the good candidate for MedsCheck, I would assume, right? And then we can talk about what happens or what is supposed to happen during a MedsCheck.
So basically, it's a government-funded program, right? So there's no out-of-pocket costs to the patient themselves, and I guess the purpose of it is the main goal of it just to help patients understand their medications better. It's basically a medication profile review by the pharmacist to identify any drug therapy problems, including like interactions, but also checking to make sure that the medication is still working well for the patient, and to ensure that they're taking it correctly. Would you say that's a good characterization? Like the purpose of the program?
Yeah. So basically, we review all the medication, right? So prescription, over the counter, supplements, vitamins, everything, and get their background as well as any allergy, medical conditions, lifestyle, and then we will check what drug interaction, duplication, side effect, any compliance issues, and then basically provide education and counseling that's based on patient needs, right? So how to use the medication, how to, what their lifestyle is, and then we communicate with prescriber to see if there are any changes necessary, right? So the intention was to actually improve patient understanding of the medication, right? Like you said. And then by that, you will prevent medication-related problems, improve adherence, maybe ultimately reduce hospitalization, hopefully, if they're using the medication properly, right? And saving money for the healthcare system, I think, right? That's the bottom line for the program.
Yeah. So I guess the premise is if we can effectively solve these drug-related problems, their medications working better, more effective for their health, they can avoid any negative consequences in their health, which can put a strain on the medical system. So yeah, that was the intention. Now, when did this program come into play?
I didn't actually look up. That's a good question. If I have to guess, maybe right 2007, 2008, maybe.
Oh, good guess. April 1st, 2007.
2007.
I would have guessed 2009, 2010. Because I thought it was around when we graduated.
It was around when we graduated. So, okay, for you guys listening, we graduated in 2010. That was like 15 years ago. The reason why I guessed 2007 or 2008 was, do you remember when we were in school? There was this course we had to do a project on. So
which project?
Like a research or like design a fake research project. And our topic was actually MedsCheck. Does MedsCheck actually lead to like improve patient outcome for, I think, like one of the chronic condition like COPD or whatever?
Was that our topic?
It was, at least that was the one I did, I think.
Were we in the same group?
I think we were. Like you can choose your own group, I think.
This is slowly coming back to me now.
Right. So that was in 2008 or 2009? So
maybe 2009 then.
2009, right? So
I think it was one of the later year projects.
So it was in 08 or 09. So that means the program must have been pretty new at that time. So I assume it would be like 07 or 08. Yeah. Anyway, so that was when MedsCheck started. So it has been around for like what, 15, 16, 17 years now. 18. My math is terrible. Anyway, so around that time, I don't think the payment actually increased, right? Has always been around the same amount.
Initially,
except
it was like
MedsCheck was new, I think.
Yes, they added like a new type of MedsCheck that you can bill for.
So it was only the original, which was $60, and the follow-up was $25, I think, at that time. And then afterwards, they added the diabetic version of the initial MedsCheck, which is $75, right? So anyway, so we talked about MedsCheck and then what the intention was. It was, it was good intention, right? But I feel like a lot of the pharmacies are not really doing it properly. And the main issue is the time constraint.
Well, before, I have a question then.
Yeah.
So if you're running a program like this, how would you know if it was successful or not? If you're the government, say, and you want to implement this program.
Okay.
So back in 2007 now, and the intention, as we said, is to optimize drug therapy for the patient. There's probably some parameters you're going to set to test if your theory is correct that this program is going to work.
So if I, obviously I don't know about this at all. So if I had to design it right now, right on the spot, I would say this. How about if you look at patients who get hospitalized, right, in any department, let's say ER. Okay, maybe not. Or choose any condition that they get hospitalized in for. Let's say heart failure, right? Or COPD exacerbation.
And you're choosing hospital because we're thinking to save the system money.
Right. Ultimately, you
Eventually.
don't want them to be like flooding the ER, right? And the doctors and nurses can help other people, right?
So that's one scenario that could occur. Okay.
So if you want to measure the effectiveness of the program, so you do that. So choose an outcome. So let's say hospitalization due to a condition, okay? And then you look at those people who actually came in and fit the criteria. How many of them actually had the MedsCheck done, right? How many of them didn't actually have a MedsCheck done, right? I think that would be a good starting point.
Okay. Would you have to do a before and after numbers? Or you just chart the numbers throughout the years?
I would do it maybe for like a year and see and follow the people, right? Choose a few hospitals, right? Designated hospital, and then see like larger hospital, like the one that you work for, right? So a few of them, and then see after a year, this is what we observe. So people who came in because of, I don't know, heart attack, right? Had MedsCheck done in the past 12 months, right? So are there any differences, right? Maybe there's no statistical difference, right? But just so that there's no statistical difference doesn't mean that MedsCheck is not beneficial, right? Maybe MedsCheck shows no benefit for heart attack, right? Maybe it shows benefit for other condition as well, right? So that's how I would design. Very crude though. So, and then you improve on the design, I guess.
We haven't looked into really deeply about this, but I find a lot of the studies that have been looking at MedsCheck effectiveness have been more focused on like how many problems did pharmacists find, how many did they resolve, rather than looking at like, was there an outcome that was actually affected? As you said, like hospitalization due to whatever condition.
Because that's ultimately the goal that you're looking for, right? You don't even have to select a condition, but if you want to like standardize it, I guess you could. You can just look at hospitalization in general for people who are taking multiple chronic medications, right?
Because you might find like random drug therapy problems, right? But it may not be necessarily that crucial to affecting their health. But that could still be recorded as a stat as, oh, I found a problem here.
Yeah, and the other thing you can also look at is because when they get admitted to the hospital. So let's say if you only look at people who get admitted to the hospital, right? The hospital pharmacist will do, I think, a reconciliation of the medication, right? So you can also look at the reconciliation of the people who are admitted. Did the people who have done the MedsCheck, did the hospital pharmacist find less issues with their medications because they've done the MedsCheck, right? So I think that's concrete number that you can actually like plot out as well, right? Like what's the percentage of patients with issues, multiple issues, right? So maybe you can show that by having done the MedsCheck in the past 12 months, the hospital pharmacists are less likely to find an issue, which means MedsCheck is somewhat successful, right?
Yeah, like this group that did receive MedsChecks versus this group that did not receive MedsChecks.
So people who actually came in and see, and then you can get some numbers. There are a lot of ways to actually measure. There's another way completely different as well. You can actually randomly select, the government can randomly select patients who have actually done a MedsCheck because they can check, right? And then contact these patients, right? What have you learned from your MedsCheck, right? It's more like quality instead of quantitative data, right? You have qualitative data as well. Like, so patient feedback, like, did you learn anything from the MedsCheck? How did you feel about this MedsCheck? Did the pharmacist actually resolve any problems? Did you have any problems going in?
Did it have a positive impact on your health?
Exactly.
Overall
Did you
well-being?
find out something that's new that you didn't know about, right? So things like that. I think there are a lot of ways that you can actually do it, right? Whether the government is actually doing it, I'm not really sure, but they're spending a lot of money on MedsCheck, right? I would assume that they would want to show that there is some positive outcome before they actually continue.
Yeah. Like, that's a good point. It's not something that you can measure in dollars, I guess, how patients actually felt about the MedsCheck service. But if they are investing this many dollars into it, we can actually look at how much the government is actually spending per year. But it's probably in like many millions of dollars, probably $50-60 million or more. It'd probably be good for them to look at, okay, is that amount invested actually being saved on the other end? Because if it's actually not, or you're not tracking it, then you don't know. Then it's really, okay, these medication reviews, they could still be done by pharmacists, but they just won't be paid for it. Yeah.
So we can look up some numbers in the article, right? So in the article
You have
said,
it up?
I have it up. Yeah. So it says Shoppers Drug Mart billed 61.9 million, right, for 1.2 million MedsCheck review over a 14-month period. So they're looking at January 2023 to March 2024. So that accounts for 60% of all MedsCheck. So if 60% is $61 million, 100% of the MedsCheck in Ontario would be around $105 million, I would assume. Like, again, math is very hard. I'm just doing it in my head. So they're spending over $100 million in 14 months, right? So it's a lot of money. So you're looking at like $90 million a month, a year, sorry, $90 million a year.
Yeah.
So
Are you getting that
getting
cost
anything?
savings or more?
Are you getting
at
anything
least
for your
that,
buck,
right?
$90 million. So anyway, the article was saying that Shoppers Drug Mart has billed for 60% of the MedsCheck done in Ontario at that time, even though they only represent around 13% of pharmacies in the province.
So
Right.
it's disproportionate is what they're saying?
Exactly. So if you only account for 13% of the pharmacies, shouldn't you bill for around like 10 to 20% of the MedsCheck? Like, why would you be billing for over half of the MedsCheck?
Well, if you're presenting it that way, I can just say, well, that's because we're so good. Our pharmacists are so good that we are able to provide that service to them.
So I think
such
there are
a higher number than other pharmacies.
Like you said, there are three main arguments that the parent company, so Loblaw, responded to, right? So they're saying that they have a larger corporate infrastructure to support MedsCheck. That's number one, right? The second one is they have central field system, right, to free up pharmacists' time so they can do more MedsCheck.
Professional services, including MedsChecks, right?
So the last one, I think, is that they have more staff and longer store hours as well, right? So that allows
More access.
and they can do more MedsCheck because they're open for longer, obviously.
Yeah.
So I think we can look at each one of them. We can go through each of them and see how we feel about that.
So first one was
Large corporate infrastructure, right?
Larger
so they're bigger.
stores.
Yeah, so they're bigger, they're better.
Longer hours.
It's like the structure, I think. They're talking about like they have a system in place to support the pharmacists to do MedsCheck or to tell pharmacists what to do, or even maybe, I'm just thinking, right? So maybe even the computer system, right, makes it easier for you to do MedsCheck. You can just do it on a computer, type it in.
The process already set in, right?
That's right. So for bigger stores, for chain stores, usually they have a workflow, they have template, everything is like set up, so it's easier for them to do. So obviously they will do more, right? So
I think that makes sense.
It does make sense, right? Their size give them like operational advantage, right? To do more MedsCheck, they're more efficient. So they're bigger, they're better, right?
I mean, it'd be interesting to look at in terms of volume wise. Like they make up 13% of pharmacies in the province, but what percentage of the total
prescriptions do they actually fill?
Yes, our population that actually go see them,
right?
Like, do they see a disproportionate amount of people versus other pharmacies? Which I'm guessing probably. Like we're in pharmacy, so we know that there's a lot of independents that do very good work as well. But the general layperson may not know that. They look at brand recognition, like Loblaw Shoppers. They're big. I can trust them because they're a big corporation. So they may be more up to choose them
to fill
versus just a random pharmacy that you don't know about.
That's actually a very good point. I don't actually have that number, but if
I don't know if that number exists.
If that number actually line up, I think they might, right? You can just randomly sample, I don't know, 2,000 patients and see where they fill their prescriptions. You can kind of guess the number, right? So by the number of pharmacy, that should be around 15%, but because of the brand name effect, it should be higher. But to justify the fact that they're doing 60% of MedsCheck, you should see 50% of the prescriptions are being filled at Shoppers, right? Which I don't think the number is that high because there are other corporate as well out there, right?
Right.
There's Metro, there's Rexall,
Walmart,
right? There's Walmart,
Costco
that fills a lot as well, right? And
that's true.
All the grocery chain pharmacy pretty much, right? So, and independent, like you said, there's hospital outpatient pharmacy as well. So I don't really feel like they fill over 50% of the prescription. I mean, if they do actually fill 50% of the prescriptions for the entire province, it would make sense that they're doing around 60% of MedsCheck too, right? So, but they only have 13% of pharmacies, right? So I feel like the number is not going to be over 50%.
Yeah, we'll have to take a look at their market share. Okay, so larger store, larger infrastructure that's set up for easier workflow,
That's what they're
so
saying.
that you can seamlessly tie MedsCheck into your daily work. Whereas other smaller pharmacies may not have that system set up.
That's their first point.
Okay.
Right. So their second point was they have central fill system, right?
Which I'm not too familiar with, but doesn't that
Free up
mean
pharmacist time. So basically, they have some of the refills, I think, get sent to central fill, right?
it's filled offsite?
It's fill offsite. That's right. So the patient will come pick up tomorrow. So they'll fill offsite and then deliver it, I guess, I don't know, overnight. And then in the morning, it will arrive in the store. And then the patient can come pick up, right? I've never actually worked in a central fill store, so I don't really know how it works. But I can say this, Shoppers is not the only pharmacy that has central fill, right?
That's a good point.
Other pharmacies have central fill too. If you're big enough, Costco has central fill. I'm pretty sure the other big corporate or grocery stores have central fill too, right? Central fill does increase efficiency, right? So I guess in that regard, that point is not like completely valid comparative to other.
It's valid in itself, but
It is.
similar to the first point, they're not the only ones that have a large store, large infrastructure to support their pharmacies, pharmacists. They're not the only ones that have central prescription filling. Does it really account for a disproportionate amount of medication reviews being done?
I mean, like, I would say this though. So if they have central fill, it makes, I guess, setting target and quota more reasonable, right? So now you have more time. You know what? You should be doing MedsCheck to make money for the company.
Well, that's what they're saying. There's more time for professional services.
They're more time, or they probably mandate it because now you have more time. You have to show that you're worth like hiring, right?
So that's what this reporter is getting at, right? Just from the title, they're saying if you don't mandate quotas, why does your staff, your pharmacist staff, perform so many MedsChecks? So their response is, well, we free up more time for them. That's one of the response. So they're able to do more. But that doesn't necessarily mean that they mandate that they must do more.
It's true. But I would say they probably suggest that they should do this, right? Now you have more time. This is the stuff that you should be doing, right? I mean, think about it. I think it's reasonable too, right? If you're the manager or if you're the owner of the store, now that your staff has more time, then you tell them, okay, now that we're not doing this, we should be doing that, right? Now that we're not doing, I don't know, now that we don't have like to worry about delivery, right? We should worry about front store, like things like that, right? So now that you're not filling prescription, you should be doing MedsCheck, right? Maybe they're saying that. They're not saying that if you don't do MedsCheck, you'll be fired. Obviously not, right? But they're just putting it out there, right? So maybe we should be doing more professional services, especially MedsCheck, right? So
there's actually some comments in this article which we'll get to, but let's keep reading on to see what else Loblaws and Shoppers said.
Yeah, so that's the second point. So the last point that they have is they have more staff and longer store hours, right? So they're open for longer, and a lot of stores they have extended hours. They have more pharmacy staff in general, so there's more opportunity to provide services like MedsCheck, right? But like you mentioned, like we mentioned before as well, they're not the only store that's open longer, right? The other big corporate also open longer, right? Rexall also open pretty long too. I mean, sure, like the grocery stores,
ones that are Shoppers, the only one that's 24 hours.
Rexall used to be
midnight stores.
Yeah, Rexall used to have quite a few midnight.
I think
stores
Shoppers right now they do have the most hours.
They do. That's correct.
But people aren't going in at midnight to do a MedsCheck.
Yes. So I mean,
they're
like
coming in to fill prescriptions because no one else is open.
Why
would I come in then to do a medication review?
And I mean, a lot of them are open later, like you said, right until 10 p.m. or midnight. But most of the patients who are taking more medications, especially more complex medication
it's going to be between 9 to 5.
They're seniors, right?
Yeah.
They're not going to be like coming in and talking about medication at 9:30 at nighttime, like you said, right? Do you think like Mrs. Smith, who is taking 10 medications, is going to come in at like 10:45 and be like, I want to talk about my like asthma medication with you? Like, when's the best time to take my diabetes medication? I don't think so.
I think bulk of those professional services, including MedsCheck, is not happening on those like off hours that they're open and no one else is open.
It's true, right? And nighttime is just to clean up the huge pile that's left over from the daytime. Right. And it's not like the daytime staff is incompetent because it was so busy. Right. So, and plus Not to mention there are less assistants, right? We worked for shoppers
right.
before at nighttime, so less assistants.
Yeah.
So if you're the pharmacist, if there is this person who's coming in at nighttime, would you rather spend half an hour talking to them about their medication review, or to clean up the 30 baskets, like 30 more baskets that's here, right?
Blister packs that are unchecked.
Exactly. So sometimes you have to, I mean, if they have a question, obviously I'm going to answer it, right? I'm not going to be like, oh, hey, Mrs. Smith, do you want to talk about your medication? Let's sit down here for like 15 minutes and talk about your medication while I have like all these baskets left over there, right? So sometimes you have to pick and choose. Honestly, the only review I'm doing at 11 p.m. is reviewing why I became a pharmacist. That's the only thing.
Like self-contemplation.
Exactly. Why did I choose this profession?
While you're reviewing that, though, you're getting paid.
That's actually a good trade-off, right?
Yeah.
Well, but I'm signing the prescriptions. There's still 50 prescriptions waiting. So
what we're saying here is that the reasons, the larger stores, the central prescription filling, and the higher weekly operating hours, they seem like reasonable, but they, practically speaking, probably don't account for that disproportionate amount of MedsChecks being billed. So further, the article actually notes that this all came about because of concerns that were raised about the program over a year ago, where a lot of pharmacists were they were going to the media and they were publicly stating that there were corporate pressures and metrics and quotas being put on them for professional services, including MedsChecks. So since then, shoppers here is saying that they're working with their pharmacy teams to ensure a more collaborative approach. And they've established this patient care and quality committee. I'm not sure what that committee does, but I guess this implies that this committee just reviews to ensure that proper care is delivered to patients, I guess, in an ethical manner, which includes not imposing quotas or pressures or metrics on pharmacists. But what do you think about that?
I mean, they have to say that. That's like PR, right? So whatever they're doing internally is a different story, right? I mean, we have worked for corporate pharmacies. We know it's a little bit different, right? I think...
but they say they've made changes.
They've made changes. So I think we might have mentioned this in our corporate pharmacy episode as well, right? I feel like the corporate pharmacy working for corporate pharmacy, the landscape has deteriorated in the past 5 years, past 10 years. So probably is a lot worse now than when we were working for them.
It's ever since the more scope, expanded scope of practice pharmacists get, the more practice is leaning towards that way, right? Which isn't necessarily a bad thing. I mean, pharmacists, if you have more power to do things to help out your patients, I think that's a good thing. But I guess what's being said out in public by pharmacists who especially work for bigger chains is that they're looking at it from a financial standpoint only, versus respecting the pharmacist's judgment in terms of delivering these services. As in, why didn't you do 10 MedsChecks? Or why didn't you do 20 vaccines today? Pharmacists might say, well, it's pretty busy. So, I prioritize my workflow. So today I had to prioritize that. So I couldn't do as many MedsChecks. Well, maybe that's not good enough because we just look at the MedsChecks numbers. But there are some comments here in the article which reflect, I guess, more so public sentiment of pharmacists who do work for these chains. And a lot of it is saying that what the article is saying, what shoppers is saying in the article is just not true.
I mean, they have to say that because it's, shoppers, they have to say that because it's for PR, right?
Yeah.
They're not going to say that, oh, yes, you're absolutely right. We have all these quota they have to meet, right? So
there's a comment here, and I'll read some of them.
Yeah.
Says, even in the interview process at Shoppers, quotas are talked about and expectations are set for daily MedsCheck targets.
Okay, so
So
basically,
it's
when
still,
you're applying for a job, they mention that kind of, right? Like, we expect you to do these kind of professional services, including MedsCheck, right?
yeah.
Day to day. I actually look at some numbers, right? So the article was saying 1.2 million MedsCheck over 14 months, right?
Hmm.
So there are actually 677 locations of Shoppers Drug Mart in Ontario.
Okay.
So that means around 1,700 to 1,800 MedsCheck per store over that period of time,
Okay.
right? If you divide it by 14, it's around 130 MedsCheck per store per month, right? So
4, 5 MedsChecks a day.
that's approximately 5 MedsCheck a day. That's right. So 5 to 6 actually,
Okay.
right? So that means they're doing 5 to 6 MedsCheck a day. In a day, I don't know.
Which just hearing that, it's not, doesn't sound too unreasonable, depending on the volume that you have.
Mm-hmm. But you
But
have time for that.
not all stores are. Do you have time for that?
Because the intention of MedsCheck is you have to sit down with the patient for 20 to 30 minutes, right?
Yeah, I don't think that's
So
happening really.
if you multiply by 5, right, that's like what,
Two and a half
3
hours.
hours. So
That's not happening.
can you imagine pharmacists walking away for 3 hours of the time in total in the pharmacy? Like, what would happen? So
It's another comment here in the article. The term used by shoppers is targets, not quotas.
mhm,
But then those targets also become stretch targets,
mhm.
which means it's I guess, an increased quota. So they're just using different words. Then.
Right, target, metric, expectation,
Yeah.
quota, whatever term you want to use
Mhm.
this year, same thing, right? It means the same thing.
I mean, I have heard that some pharmacists who work for these corporate chains, including shoppers,
Mhm.
when there's a quota like that, you don't have time to sit down for like 15, 20 minutes with each
Mhm.
patient
It's reasonable.
to really go
Yeah.
through the whole history.
Mhm.
It's more so I'm printing out this list of medications they're on,
Mhm.
and it's pre-printed by the system.
Mhm.
Says how they're taking it, what it's for, has all the information there. So I just ask them, are there any changes? Do you have any questions? No, please sign here. And that's about it.
You would select for patients who have less
Bare minimum.
less
Mhm.
issues, right?
Mhm.
Like the patients who have been taking the same medication, who have been relatively compliant, they're only taking, I don't know, metformin, rosuvastatin, and ramipril, right?
Mhm.
Here are your medications. Do you have any question about them? Do you take any over-the-counter medications? Oh, no.
Mhm.
Okay, that's fine. Can you just sign here,
Mhm.
right? So that's pretty much done, right? But the intention of the program is to actually help patients with more complex regimens, right?
Yeah.
Or if the patient, obviously, if they come in, they have only 3 medications and they have a question, they want to come in and discuss, sure, that's fine, right? But the intention is to help patient,
Mhm.
right? Not to just print it and do it for patients who are not really benefiting from this at all, right?
Like it's more so the very complex patients who are on like 20 medications, or someone who's been hospitalized for a couple months and now they're coming back out and they have a totally different medication regimen. Then it's not something that you can just review in a few minutes.
It's actually very unfortunate because I've seen a lot of the cases where when I was working for a pharmacy that's closer to the hospital, patient who came out and then they filled the discharge prescription, they usually don't come here, right? If you try to do a med check on them, the Shoppers Drug Mart that they usually go to would have done it already,
Mhm.
right? That means you don't actually, they don't actually qualify for annual med check. You can only bill a follow-up med check, which is only $25. But those patients would be the ones that benefit the most. I would actually do it at that time, right? I'll write down all the medication. Why are you taking these medications? What has changed? Do you understand this? And then I'll give it to them, right? And they like that usually. But the store only makes $25 because they usually would have done it at their home Shoppers Drug Mart already, right? Which is fine. But like you said, for the patients who have complex regimens, they usually don't get selected to do this, right? Because we don't have time for that.
Yeah, I think that's the main thing. You only have so much time. There's only one of you as a pharmacist. You have to pick and choose, because it's not only these MedsChecks or professional service you're trying to do. You also have a whole bunch of people just staring at you physically in the pharmacy, waiting there for their prescriptions.
Mhm.
There's an interesting comment in this article as well. Someone mentions here, They're so busy doing med reviews, they don't even have time to send me copies of their med reviews when requested. So this is from a pharmacist who does not work for Shoppers, saying that they asked them for a copy of the med reviews that they did. And then another comment below says, they tell me that they are stored off-site, so I actually never get to see them. That's interesting. Any of you actually work for Shoppers?
Maybe they're doing so much that they can't
let
even
us
find
know.
it because there are piles of medication reviews, right?
But doesn't it get scanned? Doesn't everything get
it should
scanned
have
in?
get scanned in the system, right?
That's interesting. But yeah, I think the main thing is that you're time limited, right? I mean, if you have an extra pharmacist there, that you can focus on professional services all day, that would make sense. But if you're just one person running around, doesn't sound like it's doable.
I mean, some of the corporate pharmacies, Shoppers Drug Mart, they do actually hire like an extra pharmacist for a few hours, I think, to overlap, and then that pharmacist will be responsible for doing
or have students
MedsCheck, or have students do it, right? But again, in that case, what kind of patients do you think these pharmacists or pharmacy students would target? Obviously, the ones that would be easier, right? If you know that you have to do 5 or 6 a day within whatever hours, right? So you would want to do the easier ones first, right?
I mean, if there are targets and quotas being set, then that would make sense. Obviously, we don't work for Shoppers or Loblaws. So okay, hypothetically, what if there was not any target, or what if there weren't any targets and quotas for MedsChecks? Do you think it's possible that we will be seeing these types of numbers still?
Highly unlikely, right?
Why? Because you're busy
You're too busy
prioritizing
doing other stuff,
other things.
right? Exactly. So, I mean, they could say that they're hiring extra people just to do these services, right?
That's not what they said here, though.
That's not what they said, right? But that would be a little bit more reasonable, right?
Yeah.
So I don't
Like
know
they're
why
investing
they
in personnel
to actually do this, right?
Yeah.
But they are. Some of the stores have some overlap to do this. I know that, right? Some of my friends have told me that as well. So maybe they're not saying it because they don't want people to think that they're abusing the system, right? They're hiring staff just to do the MedsCheck, just to build the government, right?
I've had students tell me like they know other students where their whole rotation is just MedsChecks, giving vaccines.
Yeah. Professional services, making money for the pharmacy, right?
Yeah.
At the end of the day, they don't really learn much useful stuff from it, though. That's unfortunate, right? Yeah. So, what are some of the solutions you think? Can this be fixed?
I think the government has to just take a look at. I mean, the MedsChecks program has been around almost 20 years now. They really need to take a look at to see the investment that they're making in this annually is it actually achieving the goals that they set out to achieve, which in the end is really saving money in the healthcare system. How they're going to go about that? I mean, you mentioned a few ways already, but they need to set up, I guess, a committee or appoint someone to review the program to see if it's worth continuing to invest our taxpayer money into it.
I mean, but the government by default wastes money, right? They waste so much money. Every single government, every single country, like it doesn't really matter. That's just the definition of government. Some better than others, obviously, right?
To be honest, though, right now, how high of a priority do you think this is in the government's eyes?
I mean, you don't think money is a priority? I think saving money should be a priority.
There's
always.
all this other stuff going on.
There is, but then
Tariffs that we mentioned.
But that's because of the political situation, housing crisis. But if you have more money, you can funnel more money to solve some of the problems, right? Like tariffs causing a lot of money for the province and for the country, right?
Well, for us, we see this because we're pharmacists, right? We see there's money saving. You can save money in this area.
That's actually a good point, because if you are general population won't see that, right? And other profession might see something else as well that we don't see, right? They're like, oh, this program in, I don't know, in like medicine or nursing, that's like causing a lot of money for the government. Let's say vaccine. They may be governments wasting a lot of money, like sending them tons of vaccine that they're not using, right? They're like throwing it out. Maybe the nurses are complaining too, like, why are we getting all these vaccines?
We don't see that.
Right? So, you're right. Like you said, it's just one of their multiple problems. That's money wasting. That which one should they fix first, right? So I don't really know, but I feel like it's worth saving money, right? As much as possible. I don't think the MedsCheck program needs to be stopped. It needs to change, right? If it's a valuable service, then you should treat it like one.
Do you think the college has any responsibility in terms of making sure that this program is being carried out appropriately? For example, like the documentation that's alluded to here by the pharmacists who mentioned that they want to see the documentation of the MedsCheck from the shoppers, but they wouldn't send it to them.
I think the college has the right to actually regulate that because they set the standard in regards to documentation, communication with prescriber, and things like that, right? But it is also not the college's responsibility to say that, like how they're running the pharmacy, pretty much, right? So I feel like that's not the college point. Right?
They might look at a medication review. I think it might be part of their assessment. Your medication reviews.
It's a complete,
and they may give a suggestion on how
you can improve,
but they can't say you should not have billed this, or you're billing too much,
or they cannot say that why are you choosing this person with 3 medications versus the other one with like 9 medications, right? They can't say that, right? So
because the program is actually by the ministry.
That's right. It's not the college's responsibility to save money for the government, right? So. But there are possibly other solution or improvement as well. What do you think about user paying for MedsCheck?
I think if you have the customer paying, then you will see the MedsChecks that are being done are the ones that are absolutely necessary. Because you as the end user or customer or patient, you are determining the need for it, not the pharmacy. Because you're coming in, you're saying, look, I have all these medications. I have no idea what's going on. I need help.
And you're going to pay for a service that you're satisfied with, right? Otherwise, you're going to complain, right? Like, well, they only spent 2 minutes, right? And I have to pay like $50. So
the customer is going to hold you accountable to the service itself.
I think that's one of the solution. It doesn't have to be complete. What if it's just partial payment from the customer, $20, right? And maybe the other half from the government, right? So
to be honest, like if say they can the MedsChecks program, it doesn't exist, and pharmacies decide, well, it's a good service where we believe it makes a difference. We're going to start charging patients,
they can
say
$25.
Yeah. I don't know. I don't think they're going to get the same numbers as what they're billing right now for sure.
Of course not, because they have to charge less, not $60 to
not even just the money, but the sheer numbers that they're billing.
And the number of patients that are willing to do it would be way less, right? Obviously, right?
Because the patient will decide if it's actually worth it for them. Like if I'm just taking 3 medications and I'm relatively young, like say 50, 60, I'm managing on my own.
I don't think I'm making a mistake.
Why do I need to pay for this?
That's right. So, but I think user paying part of it would solve some of the problems, right? The other thing is, what if the government scale back in terms of the payment, right? Same program, right? Intended to help patients, but what if the government only pays you $30 instead of $60, right? So,
it's a business decision. Then in that case, if it's just about the money, then there'll come a point where the payment's not worth it. Then they'll focus on other services. But if it's not about the money, then that doesn't matter.
Then they'll still bill the same amount, right?
Yeah.
So, so that's something that the government can actually consider. Think about this though. We can prescribe for minor ailments, and they only pay us what, like $19, $20 for it, right? And we still have to do all the documentation. I don't know about like other pharmacies, but technically, when you prescribe for minor ailments, shouldn't you ask for the same questions, right? Like what medical conditions you have, what medications, make sure there's no interaction before I prescribe it, right? So if you go through all that, obviously you don't have to send this much stuff in. For $19. Why are you getting $60 for this medication review? Shouldn't it be like 30 or less?
Yeah.
Right?
That's a good point.
So if you're only paying us $19, from a business perspective, this minor ailment program is almost like not worth it to do, right? Because you have to sit down with them. Exactly. You have to sit down with them and go through all this stuff. Why don't you just do a MedsCheck, right? So the government could consider actually scaling back the payment, right? That would actually decrease the excessive billing, right? If it's mainly about the money, like money making.
I mean, on topic of quotas, as I mentioned, was it a year ago or maybe more than a year ago when the pharmacists started publicly complaining about metrics and quotas, they put pressure on the college. The college recently released a couple months ago their progress, an update on addressing corporate pressures. So I'm going to read some of that update right now.
Sure.
So the college is saying they're continuing to screen the information provided to them, including some sort of, I guess, hotline and website where you can send in or submit on an anonymous online form about any complaints about, say, your corporate or your employer, if they're putting undue pressure on you to meet certain targets. And they're also saying that they're requiring all pharmacist directors to make a declaration when they apply to open a pharmacy, or for existing pharmacies that they will confirm on their annual declaration that they will not allow any business interests and management pressures to undermine or influence the pharmacist or a pharmacy's ability to provide safe care. And then lastly, they're saying just continue to share your experiences with business pressures. So it looks like they're at least admitting that there has been complaints now, whereas before they said they had no idea about it. And they have taken a step in requiring pharmacist directors or pharmacy to say that they won't do this anymore. Any corporate pressures on pharmacists, they will not do that. Do you think that's enough though? Do you think that actually affects any change in their practice?
I don't think they will actually change too much, right? But from the college perspective, what else do you want a college to do, right? So they can't really do anything else, right? So, I mean, other than making, I guess, the director declare this, right?
Like they're not going to go in. I guess you can't go in and, what are you going to do? Police them, their day-to-day operations?
Because from their point of view, they only care about patient safety, right? So can you prove that by doing this excessive? I don't think you can. If anything, it's causing, like, it's making, like, improving patient health, right? Or at least not deteriorating patient health, right? Not causing any harm.
That's a good point.
What are they going to do? What is the college going to do, right? Like, why are you doing so many MedsChecks? But the MedsCheck is intended to help patients, right?
That's actually a good point. Because right now, all the complaints are coming from, they're coming from the front line. They're coming from pharmacists. They're not coming from the patient themselves. I guess it'll be a different
story. Not going to be complaining unless they're paying for it, right? Or partially paying for it. If they're paying $20, they might be complaining, right? Like, the pharmacist only spend like 1 minute and I have to pay $20.
Or if there's patient, like if there's harm done to you, then you're going to complain to the college about it, right?
But it's highly unlikely the harm is coming from the MedsCheck, right? So
it comes in other areas, right? Maybe you're making more errors in dispensing,
right?
But can you really link it to the fact that you're doing more MedsChecks,
right? So,
or targets on other things? Yeah. So for those who work for Shoppers, Loblaws, or any corporate chain, really, let us know your thoughts.
There is one thing though the college actually could do, right? Like, because the college is to protect public, right? But it's actually protecting anybody against any kind of misbehavior by the pharmacy, right? So if you can prove that the manager or the owner is abusing the staff, pharmacy staff, right? In that case, the college could actually intervene, I think. So,
but just because I tell you to do more MedsChecks,
doesn't mean that exactly.
Abuse?
Yeah. So unless it's up to that point, right, you can't actually do anything. So from the college standpoint, they cannot really do anything else, I think, right? I just want to make that point. So, right. So because let's say if the staff, pharmacy staff, is harassing other people, harassing other pharmacy staff, then the college could intervene, right?
Okay.
So if you can actually prove that that's actually causing like damage, I don't know, emotional damage from abuse, which is very hard to prove, right? Other than that, college cannot really intervene.
Yeah.
They can only do whatever they're doing, which is, right, make them declare that they won't do that.
I mean, if you worked for Shoppers and all of these chains that do have targets, or just say they're imposing targets,
Mm-hmm.
and you complain to the college,
Mm-hmm.
you can't do so anonymously if you want them to kind of investigate, because
college is going to tell them someone's complaining against you. Okay, oh,
Well,
who's complaining
could it
against me?
be?
Oh, this person's my staff, right? So,
Or we can't tell you who it is,
Mhm.
but you only have like one full-time or two full-time pharmacists.
Mhm.
You probably kind of know already, which one's it going to be. So it's hard to really do it completely anonymously. And I think there have been like cases or reports where people do come out to the media
Mhm.
saying, when I worked for Shoppers, this was going on. When I used to work for them, this happened. That's why I quit. And Shoppers would just say, well, they don't work for us anymore. So are their complaints actually valid?
Mhm. That's true.
Right. So,
But if you're working for them, you're not going to be complaining, right?
yeah, that's right. And
So
if you don't work for them anymore, but you used to,
then
and
they're
now
saying
you're
that
coming out.
this person's not staff here. So, right? It's like that's why they would
Can't win.
You cannot win, right? I guess the other thing they can also do is to look at like pre-approval or referral MedsCheck by prescriber only, right?
Yes.
So, which we've seen sometimes in hospital, right? Patients are going in for planned surgery. They come out, like they come to a pharmacy with a sheet saying that, please go to your community pharmacy to actually do a MedsCheck. So I would actually do it in that case, right? But I find that a lot of times my patients are pretty healthy. So they end up only taking one chronic medication with vitamins, right? I was like, okay, you don't even qualify for billing, but whatever. I'll just fill in the chart. You can bring it to the hospital pharmacist to show them, right?
I think I've seen that like maybe like a handful of times only,
Oh, I've seen it a few times.
where not from the hospital, but like the family doctor.
Oh, family. I've never seen from
Says-
family doctor.
you never
I've seen
seen it?
hospital a few
I've
times.
seen it probably less than 5 times.
Oh yeah.
But sometimes they fax, so please do a medication review with this patient. Kind of similar to, please help blister pack or put the meds at dosets. But yeah, any other thoughts on MedsChecks?
That's pretty much all I have. See if you guys think of anything else. If you work for corporate pharmacies, does your pharmacy actually tell you have to do how many MedsCheck?
Yeah,
And
let us know.
Yeah,
We don't
what
know
is
anymore.
the number? We don't know anymore because we don't really work for corporate anymore.
Do you do any MedsChecks?
I do if it's beneficial for patients, right? I definitely don't do 5 a day. I don't even do 5 a year, to be honest with you. Like I said, I always do it when they come in with the hospital referral, right? Then I would do it. But honestly, from in those cases, because my patients are pretty healthy, I would say 60% of them I can't even bill at all. They don't even qualify for billing, but you still have to do it, right? So I would still go to a room and do it with them, but you don't actually bill. Anything that's beneficial for patient, I would do.
I mean,
Hospital discharge,
regardless of if this program existed or not,
yes.
what we're saying is, as pharmacists, it is your duty to actually make sure that your patient are taking their medications correctly, that there's no drug therapy problems, that you should be doing a full profile review, and you should be making sure that the patient understands how they should be taking their medications.
Whenever the medication change,
regardless of this program exists or not.
Correct.
Right?
Yeah.
All right.
So that's all the time that we have today, right?
Right.
So as always, if you have any suggestions of future episodes, feel free to reach us. You can let us know if you have any questions though, or comments about any of the past episodes. We will address those as well.
pharmacyunplugged@gmail.com. You can email us or check out our YouTube page where we live stream usually every other Friday.
Yeah, we will try to post the topic that we're streaming. If it's of interest to you, make sure to stop by and say hi. I think the PBC is coming up this week, which is the Canadian licensing exam. So if you are writing the licensing exam this week, we wish you the best of luck. Make sure you have a listen to our previous episode. Actually, we talk about tips on passing the exam. And just because you have made the right decision to tune into our podcast instead of studying, if you're listening to this episode, I can tell you that you're going to pass the exam because you make good choices. Anyway, that's all the time that we have. Until next time, have a good week, guys.
Have a good week.